Thank you for joining us. Today we'll be discussing Medicaid's program transition to Iowa HealthLink and the updates for 2016. In February 2015, DHS issued their Request for Proposal, or RFP, titled Iowa High Quality Healthcare Initiative. This program, more commonly known as Medicaid Modernization, will begin on March 1st, pending CMS approval. The goals of this program are to improve the access and quality of care for our members. We will be able to achieve a greater accountability for outcomes as we hold the MCOs accountable, and Iowa Medicaid will have a more predictable budget with DHS. DHS is contracted with three of the bidders in the RFP process: Mara Group Iowa, AmeriHealth Caritas Iowa, and United Healthcare Plan in the River Valley. Going forward, you'll hear the branding name of Managed Care within Iowa, the Iowa HealthLink, as this program links together the physical, behavioral, and long-term care services all under one program. So when you hear Iowa HealthLink, think Managed Care. Here you have a visual representation of the Iowa Medicaid program, with DHS as the umbrella overarching everything. The Iowa Medicaid Enterprise is comprised of the Iowa HealthLink for Managed Care, Hawkeye program, which will be administered by the three MCOs, and Iowa Medicaid Fee-for-Service for the excluded population. Iowa Medicaid Enterprise has also established a new Managed Care Bureau. DHS has additional staff to fully support the initiative as well as to provide oversight on the new program. Two staff are fully dedicated to oversight of quality outcomes. There is one contract administrator for each MCO, as well as additional oversight responsibilities. Here's a visual representation of the Managed Care Bureau as it provides its oversight of the Managed Care program. Next, we'll discuss how this transition impacts members. Next, we'll discuss the member populations participating within this program. We're including the majority of Iowa Medicaid members. The excluded populations would include individuals participating in the Program for All-Inclusive Care for the Elderly, or PACE, American Indians or Alaska Natives who can choose to opt into the program. Individuals that are participating in the Health Insurance Premium Payment Plan, who have medically needy spend-down, short-term eligibility, retroactive eligibility, and presumptive eligibility would not be participating in this program and are categorically excluded. It's important to note that member benefits remain unchanged with this transition. All the physical health care, long-term care, behavioral health care services that they expect and receive today will continue to be received after this transition. All programs remain the same. The only excluded component is dental services, which continue as today and are carved out of the MCOs, still staying responsibility of either the Iowa Medicaid Enterprise, the Iowa Wellness Plan Dental Program, or Hawkeye Dental, depending on your eligibility and benefit coverage. The various benefit plans also continue as is, which means individuals covered under the Iowa Family Planning Network or Iowa Health and Wellness Plan continue to have coverage, and will have coverage after the transition on March 1st. The services also are available during this transition and after, including their non-emergency medical transportation, any specialty care, and prescription formularies remain the same. There is absolutely no change to how individuals are determined eligible. Eligibility determination is still handled by the Department of Human Services. MCOs are not part of that process. MCO selection is made after eligibility has been determined and is prospective in nature only. Member education is key to a smooth transition. On-site and live communication with members and choice counseling began in October of 2015 and continues today. Here you see a visual representation of the overview of member communications. We'll be discussing this content over the next several slides. Introductory mailings were sent in October. Introductory mailings communicated with members the concept of managed care and informed them that more information would be coming. In November, the enrollment packets were mailed by population. All of this is available on our website in both English and Spanish. The MCO tentative assignment was sent along with the Iowa HealthLink Managed Care Handbook, the enrollment change forms members can use to change the tentative MCO assignment or choose to maintain and retain the MCO assignment that they have already been given. Flyers were included as well as information on where member services is holding the on-site trainings. As of December 18, 2015, well care is no longer an option through the Iowa HealthLink program. 25% of members were tentatively assigned to well care, and in early February, late January, members will begin receiving their new tentative assignments. They must make a choice by February 17, 2018 for coverage to begin on March 1st. There are several options available to members to identify and select their MCO. They can contact Iowa Medicaid Member Services by phone Monday through Friday from 8 a.m. to 5 p.m. They'll be able to do this in educational sessions. Also, through the phone line is 24/7 access, where if you already know which MCO you wish to choose, you can do so through electronic prompts. There are several resources available for members to assist in selecting their MCO. There's the in-person educational meetings held throughout the state, the Member Services dedicated phone choice counselors, as well as a DHS website with a myriad of information. The enrollment packet contained a managed care handbook, as well as a comparison guide which is available on our website to assist members, and the MCO directories of participating providers increases every day. Considerations members should be making as they select their MCO would be, is my provider participating in the MCO's network? Will my pharmacy be available through this network? Does the MCO have the value-added services that would be necessary or may be able to assist me? Do they have language lines? Do they have extended office hours and a way for me to contact them? Member services, call center representatives are also available to answer these questions and assist members in this decision. Once a member has selected their MCO, the MCO has 5 business days to respond to them and send them all their information. This would include the member's identification card, as well as a welcome packet. A welcome packet would contain anything you'd expect from an insurance carrier's welcome packet. It's going to include a provider directory, information on their grievance and appeal process, available services, and contact information for both Iowa Medicaid Member Services as the enrollment broker and the MCO representatives themselves. They will also contain information how to contact the Ombudsman. It's important to be aware that most individuals will have at minimum 2 identification cards. They will have the Iowa Medicaid card, which should be used moving forward when they receive dental services, but also because they were Medicaid fee-for-service for a time, as well as their MCO's card. Individuals participating on the Iowa Health and Wellness Plan will have a 3rd card through the Dental Wellness Plan to identify that they're covered for dental services. After members have made their selection, they can change MCOs for good cause. Good cause is after the open enrollment period and is federally defined. Individuals can choose to change their MCO through this good cause categories by contacting Iowa Medicaid Member Services, where again Member Services will be able to assist them in navigating their change. Next, we'll discuss the transition and its impact to providers. There are 2 major deadlines for any willing provider to participate with the MCOs. There's the 6-month transition for physical and behavioral health, and then the 2-year transitional period for long-term care and waiver services. The physical health care providers, behavioral health care providers participating with Iowa Medicaid should be extended and offer contracts no later than August 31st, 2016 for facility-based care, long-term care services, waiver services, integrated health homes. They should be receiving and be fully contracted no later than February 28th, 2018. It's important for the MCOs to meet network adequacy, and they do have strict network adequacy guidelines. They must have primary care providers within 30-mile radius of all Medicaid members within all 99 counties. For waiver long-term care services, they must also meet the same strict guidelines that CMS requires. The MCOs will be reaching out to providers and offer contracts to any willing provider by August 31st, 2018. And for the waiver long-term care services, it would be February 28th, 2018, as discussed on the previous slide. The IME has established rate floors that must be utilized for reimbursement for all contracted providers by the MCOs. MCOs must offer waiver and long-term care providers reasonable rate during the 2-year transitional period. The IME also announced a safe harbor period where all providers, regardless of contract status, will be reimbursed at the 100% Medicaid rate for the month of March 2016. Beginning April 1st, 2016, contracted providers will be paid out-of-network reimbursement rate of 90% of the established floor. Providers are encouraged to continue working with the MCOs to contract as quickly as possible. During the transitional period of January through February of 2016, the existing Medicaid services do continue and are fully covered. Magellan's and Meridian's contracts ended December 31st, 2016, and IME Enterprise is administering those services. The Coventry Memorandum of Understanding also ended on December 31st, 2015. The MetaPass program and managed care under Iowa Health and Wellness Plan ended on December 31st, 2015. However, those programs still continue, simply without the component of a referral necessary from a primary care provider. It is important for providers to know that MCOs will honor existing prior authorizations for at least 90 days following the transition. The MCOs will be required to pay all of the providers within similar time frames as Medicaid and will follow a timely filing guideline of 180 days from the date of service. Providers are encouraged to notify their members which MCOs they're participating with. There is a provider toolkit available on our website at the link on this slide. This toolkit has been updated to reflect the most recent information and frequently asked questions. The information includes a program overview, talks about the impact to members, and provides providers with the same information sent to members in order to assist them should questions arise. All providers, whether in-state or out-of-state, must enroll Iowa Medicaid prior to participating with an MCO. Provider Services continues to enroll Iowa Medicaid providers. The IME has established a new Iowa Medicaid Universal Provider application that can be utilized to enroll with Iowa Medicaid and select which MCOs you also wish to participate with. Providers that are already enrolled with the IME do not need to enroll again. This is strictly a form for newly enrolled providers. If you're an enrolled Medicaid provider currently, you can begin your contract efforts with the MCOs immediately. Each MCO is responsible for developing its own provider network, and the IME has provided all their enrollment data to the MCOs to assist in their recruitment efforts. When an MCO recruits a new provider who is not contracted with the MCOs or enrolled with Iowa Medicaid Enterprise, they will direct them to the IME Universal application in which to complete and select the MCOs they can participate with and enroll with Medicaid first. Any non-contracted providers may enter into single case agreements as necessary, although the MCOs will be certainly encouraging you to participate and contract with them through this transition and afterwards. All information is available on the IME website at the link you will see here on the top of this slide. Any questions from stakeholders, interested parties can be directed to the email address listed. Members and providers are able to reach either member services or provider services respectively at the email address and phone numbers listed on the screen with any questions you may have. Provider Services Outreach Team is always available to assist our providers. You can reach Provider Services Outreach through the general email address listed on the slide, and we are able to provide on-site training and will always be available to assist with escalated claims issues. Thank you.